Hi, welcome. Thank you for watching this video. Today, I'm going to be going over with you guys some NCLEX next generation practice questions, like case study questions. So I'm excited to go over with this with you. So let's get right into it. All right. Hi, my name is Nurse Choma. And today, like I said, we're going to be going over a few next generation case study questions. So in this first question, it says on the screen that we have a 52-year-old male that is admitted to the emergency department with complaints of chest pain. All right. So it says the patient's past medical history includes hypertension and hypercholesteremia. He states the chest pain started this morning and is unrelieved despite taking antacids after eating breakfast. Upon assessment, the patient appears to be diaphoretic and his skin is cool to the touch. He is alert and oriented to person, place, time, and event. His vital signs are temperature 99.6, heart rate 112, BP 165 over 96, respirations 22, O2 sat 92% on room air. He states his last blood draw was done 1 month ago and showed his sodium level was 146. The patient states, "It feels like someone is squeezing my heart." The 12-lead EKG shows ST segment elevation. Which top four client findings would require follow-up? All right. So now let's look at this closely. Okay. And when you are now, the first thing is that your goal, whether it's a case study question or a regular question like a multiple choice, whatever it is, your goal immediately is to identify what's going on with the patient. So your goal should be to be able to read everything and then come up with a conclusion, conclusion of what is happening with this patient, right? So the problem for a lot of students that are repeat test takers that struggle to pass is that you're assuming that the problem with the patient is the diagnosis that they already gave you, all right? As opposed to realizing what the new, based on all the new symptoms and their history, what is the problem that they're having right now. So you have to be able to read the question and then look at all the symptoms, all the issues, and then come up with an immediate conclusion. If you can't do that, you will struggle with these questions, right? So for example, if I'm reading all this, so I see the patient came in, chest pain, right? That's a huge clue right there. So when somebody comes to the hospital with chest pain, the worst chest pain is a true heart attack, right? Is there if there the worst type of chest pain is myocardial infarction. So when we triage a patient, our number one goal, and if they tell us they're having chest pain, is to immediately assess if it's a true heart attack, because a true heart attack requires immediate intervention. But if it's like chest pain, like for example, they ate something, then that's like heartburn, then that's not as urgent. So we ask them questions, we do their EKG, we do their vitals, we do their lab, all that stuff to help us to determine immediately if it's a real chest pain, if it's a real heart attack. That's the biggest priority. So the patient they have hypertension and they have high cholesterol levels. Those two indicators, those are risk factors for heart attack. He said the chest pain started since yesterday. He has been taking antacids and they're not working, right? So if he's taking antacids and the antacids aren't relieving it, it's not heartburn. It's a chest pain issue, right? So then it says that he's diaphoretic. His skin is cool to the touch, right? His blood pressure is high. And he even tells you that he feels like someone is squeezing his heart. And then, not to mention all this, the EKG shows ST elevation, which is a STEMI. So I immediately, this is myocardial infarction, right? So you see how I came to that conclusion based on looking at all the risk factors, all the signs and symptoms. But if you don't know, if you're thinking, oh, he has hypertension and that's it. No, you have to look at everything and come up with a new conclusion. That's the biggest thing I see with repeat test takers. I know for some that's watching this, like this is elementary. No, I have a lot of students that when they read this question, they tell me, oh, this is heart failure. Oh, this is hypertension. Some people even tell me, oh, this is COPD. So you have to be able to read and be able to come with a conclusion. And if you can't do that, then it reveals that you don't really know the content that well. So now we have to figure out which of the findings is consistent with MI and needs to be responded to immediately. Require follow-up means that you need to do something right away in order to reduce mortality risk. So client orientation, it says the patient is ANO times 4. They're oriented to person, place, time, and event. So that doesn't require follow-up. Patient is fine in that area. But the unresolved chest pain, yes, that requires follow-up. The vital signs, that's all abnormal, yes, that requires follow-up, right? The sodium level is 146. What's the normal sodium level? Between 135 and 145. So that's fine. That doesn't require follow-up, right? And then the 12-lead EKG, the ST segment, immediately, yes, do something right away. That requires follow-up. And then the fact they're diaphoretic and their skin is cool to the touch, that also requires immediate follow-up. Okay? So that's going to be, the answer is going to be 2, 3, 4, and 6. Did you get it correct? Comment below. Let me know you got it correct. So what we would do in the situation concerning each of the symptoms or all of them, they would need to be, it says right now they're on room air, right? So they need to be on oxygen. So you would apply the acronym ONAM, which used to be called MONA. You would need to give them oxygen, nitroglycerin, right? Maybe morphine, and definitely aspirin, right? And what we could also do as well is that the patient is going to need to do a ultrasound of the carotid, right? A carotid ultrasound, it would help us to know how much blockage there is because mind you, it says they have high cholesterol levels. So they may also have some type of blockage, which means that later on, not immediately, later on, they're going to need, and later on is sooner than later still, they're going to need like a cardiac catheterization. They're going to need a stent placed, right? So that way they don't have another heart attack. So that's the best answers, okay? Now, let's go on to the next one. Number 2 says, for each client finding below, click to specify if the finding is consistent with the disease process of GERD. What is GERD, right? Let me know what GERD is in the comments. GERD, right, is pretty much gastric esophageal reflux disease, right? So that's the one I was talking about earlier where it's not a heart issue, right? It's more a digestive issue problem. That's like heartburn, pain, you know. So for this one, it's going to be what? Let me know in the comments. You can stop the video. Epigastric pain. That would be one of them, definitely, right? Epigastric pain. Not the diaphoresis. That's not part of GERD. Not the confusion. But yes, the nausea. Nausea would be one of them as well, okay? All right. So the answer with this one is just going to be 2 and 5. 2 and 5. All right. Now, next one. This one says, for each client finding below, click to specify if the finding is consistent with the disease process of myocardial infarction, right? So this is the one that is based on the question. This is the diagnosis that they now have. So for this one, we have the first one says squeezing chest pain. Yes, absolutely. That's one of them right there. That's a hallmark sign of myocardial infarction is the pain is squeezing. They feel like it's squeezing as opposed to it's just like a dull or not even, sorry, not, I shouldn't use the word dull, but this one is specific to what a myocardial infarction chest pain feels like. It's squeezing it feels like there's someone squeezing their heart. not the epigastric pain because we just discussed that in the GERD. Diaphoresis, yes. So it causes them to have cold, clammy skin and they're sweating. Number three, oh, sorry, the next one, ST segment elevation. Yes, that's the hallmark. That's the worst type. That's what we call a STEMI, right? So that's definitely going to be consistent with myocardial infarction. And then constipation, no, that's not one of them. All right. So this one, the best answer is going to be 1, 3, and 4. 1, 3, and 4. Did you get that correct? Let me know right now in the comments if you got that correct. Also, I would love to hear as well what you felt like you struggled with when it comes to each of these questions, or where do you feel like you did went wrong? What do you think you could do better? Let me know in the comments.